My case is a much less acrobatic case. It's a much slower paced case. And it is a 65-year-old lady that has Fuchs endothelial corneal dystrophy and had underwent phaco and IOL in both eyes prior elsewhere. And she reports that she was very happy and seeing perfectly well for 2 weeks, up until she was traveling with her grandchildren. And then things started to go bad after that. So first time I saw her was a couple months after her initial surgeries. And this is the aspect of her right eye. We could see a very severe corneal edema in the right eye that was being caused by a detachment of her Descemet membrane in this eye. And moreover, this was also happening in the left eye as well. So her vision was compromised in both eyes. This was her vision. This was her central corneal thickness, also a little bit increased in the left, and not much of a measurement on the right side. And on the anterior segment OCT, we could see the culprit of these corneal edema. And it is amazing to see how much of a significant edema she was experiencing. And again, she was completely symptomless right after surgery. She was seeing perfectly well. So as it was 2 months after the initial symptoms, we were not completely convinced that reattaching the Descemet membrane would be possible. So we gave it a try with not much of a fully conviction. And this was the air feel of the anterior chamber. Not much of an exciting surgery to do. A couple days later, she was starting to improve. She noticed some improvement early on. She says that was less cloudy, her vision, and her central corneal thickness was now possible to measure. But she came back 3 weeks after that, and the membrane had redetached after this. You can see the central large detachment of her Descemet membrane. And this was the right eye. We can see the Descemet detached. But the thing is, we were completely flabbergasted by the fact that the left eye, the eye that we had not done anything, had resolved spontaneously. So Descemet membrane detached and then reattached with no specific treatment in the left eye. So given that, we decided just to monitor the right eye and just give it a few more weeks. And to our surprise, 3 months later, she came back with a totally reattached membrane in the right eye. And again, this happened spontaneously. We didn't do anything to fix this. Vision was improved, especially a corrected vision. She was happy with the final outcome and didn't want to proceed with anything else. Note that we can see some wrinkles in the Descemet centrally that was probably limiting her acuity here, but she was happy and didn't want to proceed with any other surgery. So, and this is the NSAC OCT. We can see completely reattached membrane. So I guess the conclusions here is that Descemet membrane detachment, it may happen after an eventful cataract surgery, even an eventful. And also in the postoperative period. And also bilateral involvement is possible. It can occur. And I think the main message here is that a spontaneous reattachment may occur, and we should all be aware of this to avoid unnecessary treatment. Or in other words, don't ever underestimate the healing power of nature, right? I think it's the message. So we've teamed with 2 other Brazilian surgeons and Dr. Rapuano and published these series of cases last year in this, and this is the paper. So again, thank you once again for the invitation. The pleasure to be here. Congratulations, Braskers, once again.